listening to the Agent Survival Guide podcast, a podcast for today's insurance agents. Informing, educating, empowering, improving the way you do business in an industry that's anything but static.
In today's episode, the insurance industry never stays still, even during Medicare's lock-in period. Today, we're taking a look at products that can keep your business chugging along when Medicare plans aren't an option. The top 5 products to sell during Medicare's lock-in period. Written by Roxanne Anderson. If you primarily sell Medicare plans but want to earn money selling insurance all year round, great news! It's entirely possible. And if you do it right, you may not have to look too hard for prospects either. They're likely already in your book of business. So, what are the top 5 insurance products to sell during Medicare's lock-in period? Here's what we think. First, let's take a look at Medicare Advantage Special Needs Plans. If Special Needs Plans, or SNPs, aren't on your radar already, now's the time to take notice. SNPs are specific Medicare Advantage or MA plans available to certain people who qualify for them. Individuals can generally enroll in these plans outside of the annual enrollment period, or AEP, upon meeting eligibility requirements. They may even be able to switch SNPs outside of AEP, depending on their plan options, and their state regulations. There are 2 main types of SNPs that agents can sell: Chronic Condition Special Needs Plans, or CSNPs, and Dual Eligible Special Needs Plans, or DSNPs. You already sell Medicare products. Why not start offering these similar types of plans and keep selling Medicare year-round? Check out the links in the episode notes for details about selling each type of plan. Next, you can try hospital indemnity insurance. Ritter IM's official stance is that anyone selling MA plans should also be selling hospital indemnity plans, especially if they offer no to low premium MA plans. MA plans can provide beneficiaries with a lot of great benefits, but unfortunately, many can also leave beneficiaries exposed to large bills for hospital stays. Hospital indemnity plans can make a perfect cross-sale, since they can fill in hospital-related coverage gaps in an MA plan and provide beneficiaries with a lump sum that can help them pay for deductibles, ER visits, observation stays, surgeries, medications, transportation, lodging, health screenings, and more. Learn more about selling hospital indemnity plans by checking out the links in the episode notes below. The third product that you can sell during the lock-in is dental, vision, and hearing insurance, or DVH. Medicare insurance typically doesn't cover basic DVH exams and services. That's why DVH plans can make for another great product type to cross-sell to your insurance clients. Many people are used to having this type of coverage through their previous employer and already understand it. Plus, no underwriting is required, making this coverage even easier to cross-sell. You can learn about selling dental, vision, and hearing insurance in the episode notes below. A fourth category you can sell during the Medicare lock-in are cancer and critical illness plans. Cancer and critical illness plans are a valuable form of coverage that knowledgeable agents who sell Medicare products can discuss with their clients. Cancer, heart attack, stroke, and other critical illnesses are extremely prevalent in the United States. Fortunately, the survival rates associated with these conditions have greatly improved over the years. However, that means more people are now dealing with the costs of suffering a major health event and managing these conditions. Luckily, you could help them be better prepared with a cancer, heart attack, and stroke or critical illness plan. Discover why this type of coverage may be worth selling in our episode notes. Did you know that long-term care costs, or LTC costs, are one of the greatest financial risks for someone in retirement? That makes it another great option during the lock-in. Many people, possibly including some of your clients, incorrectly believe that Medicare will cover all the costs associated with a nursing home or a stay in an assisted living facility if they need one when they're older. However, Medicare won't cover the LTC costs for people in need of custodial care. They'll only help pay for costs if the care is deemed medically necessary. Traditional LTC insurance plans may have had problems that haunted them in the past, but the LTC insurance market has greatly evolved over the years. Now, there are many fantastic hybrid LTC insurance options like LTC Life and LTC annuity policies, and riders available to your clients. If one of your clients doesn't qualify for an LTC plan, there are also many great short-term care or STC insurance options on the market that may satisfy their coverage needs. Check out the episode notes for our previous articles on the value of LTC plans. As a bonus suggestion, you're already a health insurance agent, so why not become a health and life insurance agent? After all, your clients are probably interested in this common type of coverage, so be an agent that can offer both. Ritter Insurance Marketing makes entering the life insurance market easy for health agents with training resources and a strong list of competitive carrier contracts, strategic partnerships, and live and recorded trainings. As with our other entries in this episode, you can find more information and full analysis on life insurance in the episode notes below. Don't let lock-in lock you out of maximizing your earning potential. If you're already selling Medicare products, you could definitely sell these other products too. You have the sales experience and perseverance. You might just need a little know-how, and we'll gladly provide you with that, in addition to all the turnkey marketing tools and strategies you need. Looking to stay active during the Medicare lock-in? Give Ritter Insurance Marketing a call, and we'll figure out which options work best for you and your next steps together. That's all for this episode of the Agent Survival Guide. We'll see you next time. The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an integrity company. This episode was written by Roxanne Anderson. Script adaptation, recording, and production by me, Jeff Snyder. Podcast design by Urban Rivera. Be sure to follow along with our show wherever you like to listen. Don't forget to rate and review our show on Apple or Spotify.